is Aurora, and I will be doing my video validation for IV piggyback, and changing of gown. First, I will say the 7 guidelines before starting any procedure. Check the physician orders, wash your hands, prepare your equipment, identify your patient, introduce yourself, explain the procedure to the patient, and provide privacy. Also, I would say how to administer before starting administering any medication. You have to check the right drug, the right route, the right dose, the right time, the right patient, the right reason, and right documentation. So first, I'm going to assess the patient's IV site for any redness or swelling. He's fine. Then I will check the IV bag, make sure the expiration date is fine and there's no leakage and that it is the correct IV bag. Now I'm going to spike it. And I'm going to clamp it. And now I'm going to fill the chamber halfway. Okay.
I think so. It's up to you. If you don't feel comfortable with it, just okay. Just take it out.
I'm going to put the base in here because since this is not a real patient, I don't want anything to leak. And I'm going to prime it. I'm going to unclamp it to prime it to see that there's no air bubbles. And there is no air bubbles. Okay. If it was a real patient, these two would go connected, but before connecting them, you have to clean them with an alcohol swab.
Let me know if you need to run. Just go like this. And I'll be like. Alright.
And this is how you would connect it.
Yeah. 3, 2.
You would connect these two like this, but since it's not a real patient, I'm going to leave it like this. Okay. And I'm going to clamp it again. And to do the drip factor, you would unclamp it slowly, and you would have to look at your watch and do it. I'm going to do 60 drops per minute. So. Hold on. There it is. Hold on. Okay, it's 60 drops per minute, so that would be 60 drops in 1 minute. So every second is 1 drop. I don't know if you can see. So that's 15 drops per 15 seconds. I don't know if you can see it. Can you see it? Can you see it? Okay, I'm going to clamp it again. And after that, I would have to put this to know the date that I put this, set up this IV, and I can put my initials right here. And I put it on the tube, the tubing. Okay. Okay, and you would leave that there. This is, so people, you have to change the IV bag every 72 hours, so this is helpful. You can also write the time, so you know when you set this up, and it's important to write the date and your initials to know who set it up. So now I will be doing my IV piggyback. For the IV piggyback, you need to set the IV piggyback higher than the IV bag, so you use this. But first I'm going to set it up. going to spike it. Okay. I'm going to close the clamp. Fill the chamber again halfway. Okay. Okay. And this part would go connected. And you also have to prime this. So you can do it a little closer. Open it, unclamp it. Okay, make sure there's no air bubbles. Okay, then clamp it again. I'm going to close it, so right now. And this would go connected here to the main IV bag right here. And you clean it. And this, and this, and this. Okay, that's connected. And to do the drip factor, let's say it's again 60 drops per 1 minute. You go here. And you have to open it. Okay. Let's say it's 60 drops in 1 minute. Hold on. So you would do 15 drops per 15 seconds. Hold on. Hold on 1 second. Okay, so there's a drop per second, as you can see. And I'm going to clamp it. And that is my demonstration of the IV piggyback. I'm going to clamp all of it. Now I'm going to show you how to change a gown while having the IV. This would be connected. So in order to change the gown, you would have to start from the opposite side of the IV and provide always privacy to the patient by covering him with the sheet. So okay. First, you remove this side of his arm out of the gown, always providing privacy by covering him with the sheet. Okay, there. And in order to do this, you would have to pull the IV through the sleeve, like this. Because it is shorter. And from that side, you have to start putting on the gown. get to this side, you have to take the ID bags, put it through the sleeve. Okay, but this is obviously connected to the patient. Okay. Then you have to, for the new gown, you have to put it in through the sleeve. Hold on. Hold on. Put it through here. And you put this back.
So we're going to, on the one side, we're going to cover. Before I do that, we must always have the labels if you're changing shifts, if you're a new nurse, so you can always check your ID bag, it's only good for 72 hours.
And then you, of course, tie it.
So you just make your initials,
Necessary, and you leave it.
you
And he's all
wrap it around
set.
the bag itself.
Thank you.